Cervical vertebrae, as you know, can flip around in almost any direction. These are the atlas and the axis. I want to talk about the atlas first. And one of the things that is a problem with adjusting is if the atlas gets cranked around anterior on one side or the other, which it often does. That I'm talking about a listing with the TP there, the transverse process. And when it gets twisted around so it's forward on one side, it's going to lock up the whole complex. It's going to make it very difficult to adjust. So usually when I'm adjusting the cervical vertebrae, I try to take the rotation out of the vertebrae first and straighten it out before I do a lateral adjustment on it and take the laterality out of the vertebrae. So you're going to find all kinds of different situations with the atlas and the axis because they can counter-rotate. They can actually counter-rotate against one another, and that always involves it flipping forward on one side or the other. So I'm going to show you some really good ways to adjust the atlas and the axis vertebrae, and they're so important. They affect all of the energy transmission from the head down, so it's really, really important to get these guys centered perfectly. Okay, I'm going to come over here and work with the model here. This is Donna, and we're going to show one of the things when you're adjusting. I told you, as I said, a lot of times it's necessary to take the rotation out before you start working with the laterality of the vertebrae. So if you're going to work on an atlas and you want to take the and axis, usually if both of them are moved together most of the time. So what I do is I palpate. This is my palpating finger to find out on cervicals what the spinous is doing. So I usually run my finger down and feel what the spinous is doing before I adjust the person. And with her, her atlas is going off to the left. It's rotating PL and superior, a little superior on that left side. She does have a little anteriority on that left side too, where it's going the same direction as C2. When I'm adjusting an atlas or any kind of cervical vertebrae, I usually palpate with this finger and I take my contact from there. So I put my finger right on the spinous and find the spinous that I'm going to adjust. I find where it's out of alignment the worst of the misalignment. And I put my finger right on the spinous, and that brings me right into taking a tissue pull to correct it. So we're finding the spinous is to the left, so I'm going to take a tissue pull to the right to make a correction. So I lift her head, and there's a little bit of a trick to holding a head correctly so that the person feels secure with your hands. And you always want to have the hands in such a way that the person feels very secure. You don't want to just like flip that neck and head around. So we're going to take a tissue pull here I'm going to have got my middle finger here on the spinous, and so I lift her head carefully and nice and securely. See how I'm holding underneath the occiput? And at the same time, I'm going to take the tissue pull with my first finger, and my contact point is going to be right here at the end of the first phalange. So I'm going to take my tissue pull, and I'm going to lift her head really securely, and I'm going to turn her head to the side. We're going to take the tissue pull on the right side here because we're correcting a left atlas, and we're going to just do a little adjustment where you take it to tension, and don't be afraid to pull the head into a tension spot till you get it to tension. And I'm just going to flip it this way when I adjust it. It's going to be a rotation. It's going to be a rotational move. Now, atlases can get very stuck, like I was talking about, when they're anterior on one side. So you want to be sure to take that rotation out before you actually adjust it laterally. When you get ready to adjust the atlas, you're going to find the atlas, the tip of the atlas, by going right at the tip of the mastoid here, going right there and putting your finger right down below the mastoid right there, and you'll find the tip of the atlas. You can feel around with your finger, and you can usually find the little tip there. So that's what I'm feeling for. And I find the tip of the atlas like this, and on her, she's on the left, so I'm kind of going against what she said by showing you on the right. But her atlas, the tip of it is right there. So when you're practicing finding the atlas, you want to take your fingers like this, and you want to go right down below that mastoid right there, and you'll feel that. You can feel around for where the tips are. Usually you can find the tip of the atlas pretty easily if you palpate in the correct position. So when you're going to adjust an atlas, you want to go right under the mastoid there and find the tip of the atlas, and then you want to slide your hand, your interphalangeal joint there, or that first one, right onto the tip of the atlas. Then you're going to take the head into lateral flexion, and you're going to, don't be afraid to crank it over a little bit, because some people are very, very flexible. So you want to get it way over till you can feel it's going to tension right there. And then you make your adjustment, and it's going to be a little up and over. When you do an atlas, when you're working on an atlas, you're going to go a little up and over when you make the correction. So what I think of is I put my finger here, I bring my knuckle right down onto the tip of the atlas, laterally flex the head, and don't be afraid to take it way over here. It's not going to hurt anybody. People are pretty flexible, actually. And then you're going to go kind of up and over with your adjustment. And I'll show that in a little bit more detail in a few minutes, but I'm going to keep going a little bit more on the cervicals. Okay, so I'm going to actually perform the adjustment on my patient here. And I told you before, she has an ASL atlas. It's off to the left. So we're going to take the rotation out first. So I'm going to actually bring my tissue pull over like this. And sometimes they have little barrettes and ponytails that we have to kind of avoid. I like to put that a little flatter. Okay. Okay, so we're going to take the tissue pull. We're going to go this way over like this and take her to tension, so you can kind of get a little feel for that. And then you're effectively, lifting like that. That was very effective. So I took a lot of rotation out of her neck there, and that's going to help free it up, so the rest of the adjustments are going to work a lot better. Okay, so now we're going to go to the other side and take the atlas, go on the atlas and take the laterality out. So I'm going to show you how I do this. We're going to go right down on that with your first knuckle, kind of bring your head over, and like I said, it's kind of an up and over motion like that. So you can actually see that flip in there, and you can feel it, and you heard it. So I got a real nice complete adjustment on her atlas now. So usually right after I adjust something like that, I do a little tissue pull on the whole neck to help integrate the adjustment. So I actually kind of put my fingers underneath, cup them underneath the occiput, and I do a little stretch. So it stretches the muscles, and it helps to integrate the adjustment and make it a lot more comfortable. So I'm going to just hold it like that for a little bit, and I'm putting a little mild stretch on it, not real hard, but just, kind of a nice tension on it. Use about the tension that you would use in a good head massage. And that helps to stretch the muscles back. They get a little cramped up when everything's out of adjustment, and it helps to stretch the muscles and give you a little bit more space there in between the vertebrae. So that feels really nice. So then I go back and I feel her along the spinuses, and everything feels like it's right where it's supposed to be now. Occasionally you'll get an atlas that doesn't want to move, and usually it's because there's something anterior. It can go anterior on both sides, remember. Anterior on one side, anterior on both sides. I get totally anterior neck sometimes. So one of the things that's a really good thing to learn is to do the toggle. That is really helpful for when somebody needs their atlas corrected just a little bit more, and it's just not going with the adjustment. So for her, I would turn her on her right side because she has a left atlas, so we're going to turn you that way. So again, you set the drop on the toggle. You're going to set the drop very light so that you can just barely push on it, and it's going to go down like that. Because you don't want to wail on the person. You just want to do a very quick little movement. So what I want to do is I want to put my finger right under the mastoid and find the tip of the atlas again. And this will really help to unlock an atlas that's stuck. So it'll help you a lot with your adjustment later if you get this in. So I just put the tip of my thumb right on the tip of the mastoid there. And my movement is going to be think up as you're going down. And my movement is going to be just straight here. I'm trying to get the atlas to go straight lateral. So we're going to just do a little like that. Very easy, a very quick way to put that atlas in. It might take a couple of drops. Sometimes it takes more than one if it's really stuck, but the relief is immediate when you put that in the right place. Dizziness. I think in the medical world this is usually called or labeled benign positional vertigo. And it's usually a subjective vertigo where the patient, it can be very debilitating. It's like they can't even, the room is spinning all the time no matter what they're doing. So we can help that. Chiropractors can help that. So I just want you to see the exact technique that I use when I work on dizziness. And I've had such great success with this. I've had some people that have had head injuries that just could barely function, couldn't hardly get out of bed, and it really, really helps to get the adjustments. It's immediate relief. They immediately feel better. So It's a similar thing. Dizziness is caused by an anterior C3. It's usually between C3 and C4. Now, it can go anterior on the right, but it rarely does. It's usually anterior on the left. I find that that left side goes forward and it just makes the world turn upside down. So one of the things that I do, similar to what I just showed you with the atlas and the axis, is I take the rotation out of it first, because it's always got a rotational component. You've always got that left anterior cervical, and it's pushing forward and lateral on the left-hand side. So the first thing I do is take that rotation out. And it would be a very similar adjustment to the one I just did on Donna that you heard that big crash. In fact, C3 went with the big crash. Actually, I'll take her head, I'll do the same thing, contact on C3, a little bit lower, come around, take a tissue pull, same adjustment. You're going to flip it forward and get rid of the rotation in the vertebrae. Then the next thing you do is you go take out the laterality. Same thing, you're going to take a tissue pull, take her head into flexion, lateral flexion, and your adjustment's going to take out the laterality. But that's not going to completely cure the dizziness. The thing that's going to give you the most trouble is the anteriority of the vertebrae. So we're going to work a little bit on that. I would have her turn on her side, just like I showed you with the toggle. Go ahead and turn on your side for me, sweetie. And this time I'm going to have her position herself so she's right about... See, I like to have the vertebrae that I'm working on to be just below where the headpiece ends, so that the rest of it's supported by the headpiece, and the vertebrae that I'm in question is the one that I'm going to actually make an effect on. So I'm going to take her, and I would actually go on the vertebrae on C3 on the lateral, and I would do a little rolling kind of a motion with the drop like this. I'm going to roll it back into place like that. It's going to be put back into place just with a little bit of a traction, a little bit of English on it, like that. Okay. So, this isn't going to completely cure the dizziness, but by this time the patient might be starting to feel just a little bit better. So I'm going to have her go on her back. And this is the last component. It's almost just like the ribs where you have to hit them from every side. And you feel right down the front of the lamina on the vertebrae. You want to feel right in there, and you'll find it. It's sticking up usually, and it's sore. So I'm going to feel right down here in the front of the vertebrae. And I'm going to find that C3. And this is another place where the pads come in handy. They actually kind of help you cushion the neck against, any of the structures in there, like the arteries and the veins, and you don't want to really put any pressure on those. So this kind of keeps your fingers off any direct contact. So then I go right on the front of the vertebrae where I've palpated, and I flip it back down this way, from front to back, like that. And that will take the last part of the laterality out of it. And you may have to repeat that a couple of times. But by the time you're through, you shouldn't feel any soreness in the front of the vertebrae anymore. It should take all the soreness away. Okay, I usually use my activator to fine-tune anterior vertebrae when they're actually being very stubborn. And one of the ways I do it in the cervical is I turn the tension all the way down to the lightest tension on the activator. So it's just giving no wallop, no nothing. It's just really, really light. And then you find the front of the vertebrae that you're going to work on, especially with the dizziness, and you can go right on the front of the vertebrae like this and use the activator on it like this. And it doesn't take a lot, but it'll actually put that vertebrae, it'll take that little anteriority that's left and put it back into place. And that, between all those three directions that I showed you, that should actually take care of the dizziness. And the person should feel much better at that point. They should start feeling better. You can get them up and you can kind of see how dizzy they are. Sometimes it takes a little bit more work. It might take you a couple of treatments to get rid of the dizziness completely. But you'll find even some people are very stubborn. I had a person that had a very bad head injury, and it took me about a month to get rid of her dizziness. But every time she felt better, every time the dizziness was less debilitating, so they can tell that they're on the right path. It's just that sometimes it takes a little more time than others.